He fell asleep during breakfast. His mother tried to wake him. He wouldn't open his eyes. This was not ordinary sleep. This was something his brain had decided to do without his permission. And for the next 3 weeks, he would sleep 23 hours a day. The boy was 10 years old. By every documented measure, his life had been completely ordinary. He played sports. He did well in school. There was no family history of neurological disease. And then one morning in early spring, he went to sleep and didn't wake up. His parents took him to the emergency room. The physicians ran a full workup, blood tests, CT scan, EEG. Everything came back normal. They sent him home and told his parents to monitor him. Within 48 hours, he woke up on his own. He was groggy and confused, but otherwise fine. The doctors said it was probably a virus. 3 months later, it happened again. This time, the episode lasted 2 weeks. He would wake only to use the bathroom and eat. When he was awake, he didn't seem like himself. His speech was slow. He didn't recognize his own bedroom. His mother asked him questions, and he answered in fragments. Then he would go back to sleep. The pediatrician referred him to a psychiatrist. Depression in children can manifest as withdrawal and excessive sleep. The psychiatrist prescribed antidepressants. The medication did nothing. The episodes kept coming. Every few months, sometimes every few weeks, he would fall into a sleep state that lasted days. Between episodes, he was completely normal. He went to school. He played with his friends. There was no gradual decline. The sleep would arrive suddenly, like someone had flipped a switch in his brain. His parents began to keep a journal. Episode duration. What he ate when he woke up. What he said. They brought the journal to every appointment. Neurologists ordered more tests. MRI of the brain. Lumbar puncture to check for infection. Sleep studies to rule out narcolepsy. Every test came back normal. For 2 years, no physician could explain what was happening. His mother started to wonder if they were missing something obvious. If every test showed a healthy child, maybe the problem was something else. Maybe he was choosing this somehow. Maybe it was behavioral. She hated herself for thinking it. But when every doctor says there's nothing physically wrong, you start to question what you're seeing. Then came an episode that lasted 4 weeks. He missed an entire month of school. When he was awake, he ate compulsively. He would empty the refrigerator and still say he was hungry. His behavior changed. He made inappropriate comments to his mother that he would never say when he was well. She documented everything and brought it to his neurologist. The neurologist paused when he read the notes. And then he said something she hadn't heard in 2 years. "I think I know what this is." But here's what made this case different from everything doctors expected. The sleep wasn't the only symptom. The cognitive changes, the compulsive eating, the inappropriate behavior, they were all part of the same neurological event. And they all pointed to one specific region of the brain. Kleine-Levin Syndrome, a neurological condition so rare that most physicians never encounter a single case in their entire careers. It is sometimes called Sleeping Beauty Syndrome because patients sleep for days or weeks at a time, waking only briefly before returning to sleep. But the name does not capture what the condition actually does to the brain. The hypothalamus, the brain region that regulates sleep, appetite, and behavior, appears to malfunction during episodes. Researchers believe the dysfunction causes the brain to enter a state similar to hibernation. The patient is not choosing to sleep. Their brain is forcing them into a sleep state they cannot control. Kleine-Levin syndrome affects approximately 1 to 2 people per million. 70% of cases occur in adolescent males. The first episode typically appears between ages 10 and 20. Episodes can last days to weeks. Between episodes, patients are completely normal. Brain imaging during episodes shows reduced activity in the thalamus and hypothalamus. But when the episode ends, brain function returns to baseline. Why it took 2 years to diagnose is not a failure of medicine. Standard sleep disorders like narcolepsy or sleep apnea follow predictable patterns and respond to testing. Kleine-Levin Syndrome does not. The sleep studies are normal because the sleep architecture itself is not disrupted. The patient is simply sleeping far more than a human should. Blood work and imaging are normal because there is no structural damage or infection. The condition only reveals itself through the pattern of episodes and the associated symptoms during those episodes. Treatment options for hypersomnia conditions like this are limited. Stimulant medications can help patients stay awake during episodes, but they do not prevent episodes from occurring. Some physicians prescribe lithium, which has shown modest benefit in reducing episode frequency in some patients. But there is no cure. The condition manages itself. Most cases resolve spontaneously after 8 to 12 years. The episodes become less frequent and eventually stop. Researchers do not know why. What researchers cannot yet explain is what triggers the hypothalamus to malfunction in the first place. Some cases appear after an infection, suggesting an autoimmune component. Other cases have no identifiable trigger. Genetic studies have found no consistent mutation. The condition appears, dominates a patient's adolescence, and then disappears. Medicine can document it. Medicine cannot yet stop it. For the boy and his family, the diagnosis changed nothing about the episodes themselves. He still slept through weeks of his childhood. He still missed school, missed birthday parties, missed entire seasons. But the diagnosis gave them a framework. They knew what to expect. They knew it would eventually end. His parents learned to recognize the early signs. A certain look in his eyes the day before an episode. A shift in his speech pattern. When they saw those signs, they prepared. They notified the school. They cleared their schedules. They waited. What this condition reveals is how fragile the boundary is between wakefulness and sleep. Most people assume they control when they sleep. But sleep is regulated by deep brain structures we cannot consciously access. The hypothalamus coordinates signals from dozens of brain regions to keep us awake during the day and asleep at night. When that coordination fails, even for reasons medicine cannot identify, the patient loses control. They do not choose to sleep. Their brain makes the choice for them. By age 19, the boy's episodes had stopped. He had lost years of his adolescence to a condition that medicine still does not fully understand. But he finished high school. He went to college. His brain, for reasons no researcher can explain, stopped forcing him to sleep. The hypothalamus recalibrated itself. The episodes never returned. He was standing in the kitchen making breakfast. Nothing unusual was happening. And then he felt it, the overwhelming need to sleep. But this time, he knew what it was. This time, he had a name for it. If your child fell asleep today and wouldn't wake up, and every test came back normal, would you know what was happening? This video is based on real, publicly documented medical case reports and is intended for educational and storytelling purposes. It is not medical advice. If you or someone you know is experiencing similar symptoms, please consult a licensed physician. Medical mysteries. True cases every week.